So good morning, good afternoon, and good evening to all the participants who joined globally for this webinar. A very warm welcome to all of you. Persistent, along with Microsoft, has been pioneering to revolutionize the healthcare industry with the Microsoft cloud-based Patient Next platform. To discuss more on this, today we have on this panel along with me, Mandira Anand, Director, Partner Technology, ITeS-Microsoft, Puneet Jeyasingh, Principal Solution Architect, Microsoft Cloud for Healthcare, and my colleague, Subhendu Brahmachari from Persistent Systems, joining us for this webinar. Over to you, Mandira.
Sure. Thank you, Dr. Ratnakar and Subhendu, for this brilliant opportunity. Good morning, good evening to all of you who have been, able to join us today. Before we begin, I would like to start by sharing our mission at Microsoft. Our mission is to empower every person and organization on the planet to achieve more. Now, this purpose really has acted as a North Star in everything we do, every technology we build, every product choice we make, and how we show up for our partners and customers. But this statement is just not a set of words, right? When we talk about empowering people, we simply mean that we offer the right tools, the right technology, the support, and that inspire people to innovate and enable them to do more with less. Although the last 2 to 3 years, did accelerate cloud adoption in the recent past, many challenges remain on the IT leaders' minds. Legacy IT architectures, how do we modernize with cost optimization? And once we've optimized, how do we really monetize costs? How do we get ahead of what our business needs, needs to be digitally resilient to thrive in the next disruption? And so healthcare is no different, right? The tools available to providers today are drastically reshaping the way we think about care, how about healthcare, and how patients engage with their own health, right? How they consume healthcare. If you can, thank you. I'll take the next few minutes to talk about some, most relatable and common trends that we see in the healthcare space. None of us can ignore the fact that healthcare is becoming very personalized and thereby actually driving elevated patient experiences too. They're altering and redefining the whole trajectory of consumerism in healthcare. I'm sure all of you will agree. And patients and providers demand quicker, easier access to medical data, both you and me as well. More personalized care, and the highest level of data security, most importantly, across all devices that we access to prevent cyber attacks and data theft. And if specifically to talk about US healthcare, we're really anticipating the US healthcare spend to reach about 6.2 trillion by 2028. And that sort of sets the landscape, right? Now, the phrase frontline healthcare worker invokes, brings in a lot of images about emergency rooms and, doctors and nurses and, patients coming in distress, and COVID has given us many of those images that we want to really forget. And, talking about triaging the severity of the condition, etc. But that's like only one, I would say like one cohort of frontline healthcare work, right? But if you look at the pandemic, over the last 3-4 years, it has forced clinicians, nurses, healthcare staff, and everybody that's like in the, in the healthcare to sort of, rise to, the unprecedented volumes of patient care. And, this is sort of really changed the whole landscape in terms of the pressure that was really on the frontline workers, right? And pandemic has forced this situation, and these moments, although we rose to the situation, these moments demonstrated the power of people coming together, and more importantly, technology sort of enabling them to adapt and find new purpose in unpredictable contexts like these. And we cannot predict what's really lying ahead of us. That brings me to the next point, right? Enhancing patient experiences, enabling the healthcare staff to be able to do more with less, being able to sort of provide a seamless end-to-end experience for both the clinicians and the patient, and eventually the entire healthcare staff. But the backbone to all of this is really, how are you leveraging digital technologies to elevate this experience, elevate healthcare? Well, what will an organization really do with digital technologies without leveraging data that is really at the core of the transformation? Now, we do understand that, and we've been talking to partners, we understand, and we've been reading, hearing ourselves that healthcare organizations are experiencing severe and several barriers to monetizing their organization's data for obvious reasons, the kind of regulatory and compliance requirements that we have in place, the siloed piles of data for decades together, sitting in different disparate systems, poor data reliability, issues with data protection and privacy that, most important, a critical piece of this whole changing gamut of things, right? Challenges to protect and secure information about the patient, and the need to know, the need to sort of new skill sets with the whole emerging medical technology that's really coming into play. As a result, healthcare organizations are looking for a new approach to pave the way for future stability and resiliency. And what we are constantly hearing is that healthcare is not behind today. Healthcare organizations are not behind today in prioritizing cloud services to drive digital transformation because of the ability and agility to sort of speed up their deployment, to lower complexity, to save costs, to optimize, and to manage upfront investment. Okay.
Well, thank you so much, Mandira. That was a great, and start and talking about, what Cloud for Healthcare would offer. So if you look at Mandira's slide, from that coming back to this slide, if you're just matching the colors, the orange or the yellow ones are the ones which talk about, the challenges that we are trying to solve. So those are the challenges. And here we're going to talk about, how Cloud for Healthcare is going to help in this matter. So this particular wheel, when you see, this is, when we have conversations with our partners and our customers, this is likely the first slide that we show, because the reason is it kind of shows the areas that we are able to focus on and what we are good at and where we can help our partners. So if you look at this slide, the purple one right in the middle, you look at it, that data is in the middle. That is that illustration here, because Microsoft in our healthcare business, we firmly believe that we have to help our customers get their data estate, their clinical data, their medical imaging data, all sorts of data into a repository that is open and accessible with standard sets of APIs so that they can begin to do richer things with that data and get those insights and drive actions. So, like all that data is tied up inside, proprietary EHRs or proprietary data warehouses and things like that. So we are working with our partners like Persistent, so that they can work with the customers to get that data out and make that data more actionable and provide more insights out of that data. And the next thing you see around this wheel is the security and compliance. So anytime you get into the healthcare data, it is highly regulated and private. And that security and compliance is inherent to our platform, So we've got a lot of strength here, which makes the healthcare, companies to take advantage of. So that is one of the compelling factors as well. So now looking at that wheel, you're looking at those 4 areas. Here, healthcare industry, as Mandira was talking about, has significant challenges around the 4 things that you can see around the wheel. So enhancing patient engagement, empowering health team collaboration, improving clinical and operational insights, and enhancing the clinician experiences. So here, outside the wheel, if you look at it, this kind of, talks about those 11 capabilities which we are providing as Cloud for Healthcare to help solve for those 4 challenges. So our capabilities help solving for those 4 challenges. So if you look at the, starting from that upper right side of the wheel, the personalized care, right? So how we are able to provide, personalized care to help healthcare customers to build better relationships with their patients, right? For example, we'll get more into it. We have patient portals, we have, the digital front door bots, and we've got, the patient outreach, the marketing material, marketing content, so that, the partners can build on top of it to create custom built solutions for their customers. And patient insights, the next one, if you think about it, the key is, how we are enabling our customers and partners to bring that disparate sets of data into different locations so that they have that unified data set, so that we are able to provide that patient 360 or a member 360, however you think about that, to get that longitudinal patient record. And then the virtual health, it means many things to many people. For IT, it might just be a Teams visit, but it is much more than that. If you talk about in the healthcare industry, starting from when the patient, has an issue, reaches out to the doctor, by the time they check out and all that. So that whole virtual health can be provided with the cloud for healthcare. And then you look at the second set of it, improving clinician experiences. In that, you can see clinical analytics, right? Enabling predictive, personalized care by analyzing unified sets of data with Azure AI and machine learning. And operational analytics, you can optimize, supply chain, forecast patient volumes, forecast staffing, cost management, and utilize, your existing resources to improve, the outcomes. And then the next one on the upper right hand, you can see is the care team collaboration. Here, the goal is to, save time and resources by improving collaboration. Care coordination is all about, how the care team can track activities and goals, within the care plans and share them across, the clinician teams. And then when you look at the, under the enhanced clinician experiences, those three capabilities, those are, since we acquired Nuance last year, sometime in March or April. So those capabilities come as a part of Nuance. And, like, for example, Nuance's Dragon ambient experience is an AI-powered, voice-enabled solution, which can automatically, document patients' encounters accurately and efficiently, and at the point of care. And it can be also used in telehealth. And then the clinical documentation. And then the last one is, the diagnostic intelligence here, which is, Nuance's Power Scribe. It's more meant for the radiology kind of the department. They kind of leveraging that. And then if you look at the bottom line here, you can see is on the layer, what is it built on, right? It's built on top of, leveraging FHIR compliances, EHR connections, compliance again, health analytics, and cybersecurity. All that is inherent to cloud for healthcare. All right, my timing was good on this one. So the next slide is a very busy slide, right? So bear with me. Let's start reading that slide from bottom up, right? So the very, if you look at it, green one talks about, the limey green is the partner opportunities, which you can think about. And the dark purple is the, what are Microsoft core technologies. And the purple one is the core healthcare solutions. So if we start reading from the very bottom, so bear with me on this one, stay with me here. So from the, if you look at the last one, first of all, there's a huge partner opportunity, because this is, like I talked about the wheel, but this kind of shows about that end-to-end journey in a different formats. So first of all, health data is fragmented across multiple systems and formats. And this data lives in different silos. So that's a huge problem. So the key is to get that data out of the data sources into an ecosystem. So there is a great opportunity here. If you look at the vertical, the very first one, it talks about, you can see it says the use cases, right? For example, that's a great opportunity for the EHR or EMR integration partners if they just want to focus there and build some connectors, let's say getting the data out of Epic or Cerners and things like that. So the next one is then the data, let's say the data is coming in, you can ingest the data using Azure. These are just some examples, talking about, okay, there is an opportunity here you can see. For example, you can leverage Azure Health Data Services, which makes anyone, working with the health data to ingest, manage, persist PHI in the cloud. So at this point, if you can look at the use cases, data interoperability, and in that Azure world, you also have Azure Health Bot, where, like, for example, for your digital front door solutions, that's similar to, like, you can have a bot on your website, and that is, already a pre-built bot using Azure Health. It's got all the features and functions of, healthcare there. And then after that, you say, okay, let's just bring the data to Azure, right? That's an opportunity. You can bring the data to Azure Synapse, where you can take advantage of AI and ML. And you can start thinking about, predictive, prescriptive, clinical, operational analytics and things like that. And also remote patient monitoring can come in this area. So now, after that, let's say, you want to go further than that, where you see the common data model. So we have the common data model in the dynamic side as well as in the analytical side for Synapse. So we have Azure healthcare database templates for Synapse. And you can leverage that for any of the analytical use cases. Or if you want to focus on the transactional use cases, you can get the data to Dataverse using the healthcare common data model. And then after that, you can build applications. If the data is on the Dataverse, you can build the applications using Dynamics, using Power Platform, low code, no code applications. And then on top of that, which you see the Microsoft Cloud for Healthcare add-on. So sometimes some folks confuse, they thought, add-on was the only thing of Cloud for Healthcare. No, but here you can see how end-to-end we have, Synapse templates, we have Azure Health Data Services, all that is a part of Cloud for Healthcare. But that add-on, if you think about it, that is, we have built our first party Cloud for Healthcare. You can think about it as a building block or an IP, which you can think about it as a industry specific IP, which is packaged as a solution. And we are providing, a few applications for you. Like, for example, patient portal is given as a part of that, patient outreach, which is nothing but a patient marketing application, which comes as a part of that, or a care coordination is the other app, which is there as the first party. So that way, let's say if somebody wants to build care coordination, right? They don't have to start from scratch and, build it on any other, tool. You have it already, but then you can customize it for your customers, depending on what they are looking at. You can add more fields, features, customize it, add the different flows and things like that. That's where you can leverage, Cloud for Healthcare add-ons. Then on very top, which you see Nuance, after our acquisition, if you want to build your extend solutions using Nuance, you guys can do that as well. Like, for example, the DAX, the ambient experience for the clinical documentation and things like that. So based on, what use case you have, you can build an end-to-end solutions. You can leverage all these services, or think of it like a Lego block, right? Pick and choose. Okay, maybe I want to do this, maybe I want to add that. And bottom line, it is to help solve for those challenges that you can see on top of the screen. Enhance patient engagements, empowering health team collaboration, improving clinical and operational insight, and enhancing the clinician experiences. So now we can go to the next slide. All right, so this particular slide kind of gives you an idea of how does Cloud for Healthcare come to life, right? So if you start looking at the bottom, right, you can see Cloud for Healthcare is built on top of Azure, Dynamics, and our M365. And because it is an extension of our existing clouds, right? So it sits on top of our existing cloud. It is not a separate cloud or anything like that. So our approach was to light up healthcare features on our existing clouds. That's what we're trying to do with Cloud for Healthcare. So in this particular picture, the bottom line, you see the Microsoft Cloud. And then the second one, when you see that plus where it says, healthcare features and engineering solutions. So here, if you think about, the red one, tells from the Dynamics, we've got, customizations, configurations, UI. That's where, we've got a lot of those first party apps that I was telling you about, right? Like, for example, patient portals, and we've got, care management, and we've got patient outreach. Those applications come under that area. And if you think about in the Azure world, right, you can see that we have the Azure Health Data Services, which can help you ingest, the FHIR data, which is coming from, the Epics and the Cerners, from the EHRs. Or you can think about, DICOM data, IOMT data. That's where you can leverage, Azure Health Data Services to bring that data and then make some value out of that data. And we also have, pre-configured workflows, and you can see the we are also providing some templates. Azure Health Pod is a part of that. So this kind of gives you an idea about, the healthcare features and what engineering solutions we have. And then when you look at that next picture, the wheel right here, that's what we talked about. So if you read this slide, it's the Microsoft Cloud. It's got those healthcare specific features and applications to help solve for those healthcare, those capabilities that we talked about. And then the main thing here is the beauty is the solutions and the third party solutions, right? Like, for example, in this case, how we are working with Persistent for their, patient care, next platform. So this is how Cloud for Healthcare comes to life. You have Microsoft capabilities, and you merge them with those partner capabilities to build for, those to help solve for those specific use cases and things like that. So holistically, this is what the whole thing is like. If you look at that whole box, right, that is Cloud for Healthcare, like Dynamics, Azure, Power Platform. But the partners make it easy, right? They make it much simpler. They know how to tie all the pieces together and make it so simple for you so that you have, a solution right in front of you. Okay, here is the solution. Now the customer can leverage it and it can be customized and things like that. All right, so this is my last slide. First of all, there is a link there, what's new. We might be sharing that link as well. So you can always check that link on the bottom of the screen, that orange link, which says new and planned. Otherwise, I'll just maybe paste the link also. So there is always, you can check out the roadmap for Cloud for Healthcare at any time. So from that left hand of the slide, first of all, just to give you this is like, give a quick pitch what it is, right? We came, this was the first industry cloud from Microsoft, Cloud for Healthcare. And it became GA in October of 2020. And we have biannual releases in April and in October. So that link, you can go check out and see what's planned for what's coming and all that. And we talked about those, 4 key pillars, which Mandira also mentioned in the beginning of the slide. And then we've got that everywhere, so that it's ingrained that, okay, those are the, key pillars here. And we had first 3 pillars during our initial release, and the 4th one was added. Enhanced clinician experience was added since we acquired Nuance. And another thing is, I would like you guys, whenever you want to check out about these capabilities or learn more about Cloud for Healthcare, I would recommend you go to aka.ms/solution center. The link is right on this page. That kind of gives you a beautiful view of, what is available in Cloud for Healthcare, how for each capability, what is needed. So if you want to learn more about that, and there is a quick view, there is a quick guide how you can learn about Cloud for Healthcare. So now talking about what is new. So initial release was very much provider centric, but now we are adding, we have added data models for pharma, life sciences. So we are enhancing Cloud for Healthcare. And we are also adding, the virtual health tables, so that you don't have to, if you don't want to like duplicate things, so you don't have to add all the data in one place. So I would say the best is check out that link and learn more about the roadmap. Thank you.
Thanks, Puneet. Wonderful to hear from you about Microsoft Cloud. And you have actually pointed out the use cases which partners like Persistent can actually look at. And the next 10 minutes, you'll be happy to see that most of the use cases are answered in the Patient Care NXT. So Patient Care NXT is predominantly developed to cater the ever-evolving patient requirements. They are actually going multifolds every time we speak. With its innovative digital interventions, the platform is providing holistic and a comprehensive patient care, which addresses the challenges in the healthcare ecosystem. With the patient priorities and the providers' objectives in mind, this comprehensive Patient Care NXT solution is built, which ensures the safest, highest quality care, as well as ease for use for both patients and providers. For patient acquisition, and also to provide better access, which you mentioned a couple of minutes back, a self-service portal is already built in with a connected health features, which are all integrated into this platform. There is also an advanced analytics, which is provided on this platform predominantly to give real-time clinical insights. I think that is one of the important factors which you're iterating a couple of minutes back of how the clinicians will be able to get outcomes which are more relevant for their practice in a day-to-day life. And more importantly, you're also happy to see that features like gamification are built in, which helps in terms of treatment adherence across the value chain, because today's context, treatment adherence becomes a major concern both for providers, obviously for the treatment outcomes for the patients. That's where these innovations are built in into Patient Care Next, and it actually gives a comprehensive proposition for all the providers and also for the patients at large. The real-time clinical analytics is area where we have built in, which should talk more about how the clinicians can actually have access to the real-world data in terms of providing them more insights and also better treatment at regular intervals, both for chronic as well as for acute patients. So moving on, let's also look at how they are currently looked at in terms of challenges. Today, there are a number of challenges which are unaddressed, and healthcare system is grappling with all these challenges at regular intervals. Patient Care Next addresses all these important issues, right from the care coordination, clinical documentation, which is of highest and paramount importance for the healthcare organizations, and also the Patient Care Next with its advanced features supports the entire ecosystem seamlessly. Individual care plans, which is of very important for all the the patients at large and also the providers, is integrated, which also has the ability to access all the diagnostics. All of them are embedded into the self-service portal of Patient Care Next. More importantly, the predictive analytics models are plugged in, which provides a real-time clinical outcomes for providers in order to manage the treatment adherence, also to monitor the outcomes across the treatment goals. I think that's very, very important in today's context, where the disease outcomes are actually being provided to those those doctors who can actually look at the dose titration, who can actually look at revising their treatment protocols in order to manage the outcomes and also look at the goals which they have actually come out for the management of healthcare for patients at large. I think these are very, very important in terms of the challenges, and those challenges are actually being built in, which gives a comprehensiveness for the entire platform at large. Moving on, I think what is also important is the Patient Care Next, with the aid of next-gen technologies, is enabling the entire healthcare ecosystem's digital transformation. That's what, Puneet, you touched a couple of minutes back in terms of how the healthcare ecosystem is embracing the digital transformation. That's where Patient Care Next, with its advanced features, is trying to address the healthcare's needs in terms of this transformation journey. I'll pick up a couple of examples. For example, if you're looking at the decentralized clinical trials, which is today's the norm in terms of managing the entire clinical trials seamlessly, but that's all possible only with the connected health. And needless to mention, the newest technologies like AI and ML, all are embedded into this Patient Care Next, which is aiding, more importantly, the remote patient monitoring. Advanced features are built in like gamification, AR, VR, all of them are actually aided in terms of providing ambient clinical intelligence, which is also being provided through the mobile applications. That's pretty important, because when you're looking at the remote clinical trials, remote patient management, mobile applications, as you know, makes a much more difference for the ease of management of the clinical trials. For the management of adverse events, that's also yet another important area which today both the chronic care, acute care, and also the rare diseases patients are actually reporting at regular intervals. So we have built in the robotic automation with natural language processing embedded in terms of providing an integrated pharmacovigilance, which can actually give a real-time view in terms of the adverse events. And more importantly, not only view, how the providers can actually address these adverse events real-time and then manage their patients in a much better way. So more importantly, with the advanced analytics built in, that's also trying to provide real world data on the clinical outcomes. I just wanted to spend a couple of minutes over there. Today, patients are siloed, providers are siloed, clinical outcomes are actually residing in the electronic health systems. What is important for a provider is how can they actually have an access in terms of the treatment outcomes on a real-time basis. If there is a goal for a treatment goal for a provider, and if the patients are actually given a treatment, it's also important for the provider to understand how those goals are actually achieved, what are the kind of gaps over there, and is it actually providing them a room to monitor, and is there a longitudinal view for them to do a kind of dose titration whenever required, or also manage the treatment protocols on a real-time basis. That is more in terms of managing the patients. Even in terms of managing the clinical trials, if there is a real-world data available for the providers, it becomes seamless for them in order to manage the clinical trials in a much effective way. Net, Patient Care NXT today gives the entire digital transformation at every stage of the healthcare ecosystem. And more importantly, with these next technologies, it's able to provide the providers as well as the patients a kind of an experience which wasn't there prior. And that's where the Patient Care NXT is working towards in terms of bringing in that transformation and that change for the entire ecosystem. And with the Microsoft Cloud, I think that's making seamless. Now that you heard from me, I think it's also important for you to see how it looks like. I think all of us are looking forward in terms of seeing how it is. And I will turn towards Mandira and Subhendu to take it forward next.
Sure. Thank you, Dr. Ratnakar. Hello, everyone. This is Subhendu. So now I'll walk you through a short demo of Patient Care NXT, in which I'll showcase 3 salient features of Patient Care NXT solution. First one of them is patient journey to offer omnichannel and personalized patient experience across patient lifecycle. Second one is care plan template and real-time clinical analytics for practitioners, basically to improve treatment outcomes in real time. And third one is patient self-service portal to boost patient adherence to treatment and to self-triage patient symptoms. So let me share my screen. Yeah, so for the demo, right? Basically, let's take up a use case of fictitious healthcare company named Venus Healthcare launching a new service line called hypertension, right? So so that is where Patient Care NXT platform has a unified patient data platform and I mean disease propensity predictive models, leveraging the patient data platform already built in, which help Venus Healthcare to build a, let's say, targeted set of patients who are at risk for hypertension. Now, the next step for Venus Healthcare is to reach out to those targeted set of patients and engage with them across the patient care life cycle, all those 3 phases, right? Pre-care, care, and post-care. So that is where the patient journey feature that our solutions provides comes into play. So as you can see on the screen, this is the patient journey, and patient journey can enable Venus Healthcare to create a end-to-end streamlined and automated flow to engage with the patients. And it not only helps you build the flow and automate it, it also gives you real-time meaningful insights in terms of how many patients, let's say, have seen the email, right? How many patients has opened the email, and it also enable you to send reminders as and when needed, right? And follow up with them. We have WhatsApp, SMS, and other channel embedded into this flow to make it a truly omni-channel and to offer a truly omni-channel and personalized patient experience. So this is the first one that I have in my bucket. Second one is basically, as I mentioned, the care plan part of it, right? So let's assume the patient is now in the hospital to get his or her symptom treated, right? That is when our solution provides care plan templates. Yeah, care plan templates, which helps or which enables practitioners to quickly create treatment plan for the patient, right? So if you see on the screen, this is a sample care plan that I have, care plan template that I have. So it gives you, I mean, it helps to set, it basically has all the goals, right? Care plan goals and the associated activities, right? So if you see, this is the goal for a hypertension care plan template, that you get your blood pressure controlled to under 130 to 90, and these are the care plan activities. Now practitioners can quickly create a care plan once he is having a conversation with the patient, and he can inherit this care plan template, and all the goals and activities for the patients will be created real time, and practitioner can also customize the care plan as needed. So this is the second part of the feature. And here also I would like to showcase one more thing. So as I mentioned, right, so care plan, I mean, in Patient Care NXT also offers real-time clinical analytics. What that means is, so this gives you, there are, as part of this solution, we have built quite a few analytics. Just to show you on the screen, we have 3. So as you can see, so this particular analytics is giving you real-time insights into the treatment adherence part of this particular patient. We have this analytics built at an organization level as well. And this is the one where it is talking about how the patient is adhering to the exercise prescribed by the practitioner. And this basically gives you an idea about how effective the drug is for this particular patient. Now, how, I mean, let me tell you the immense value that this analytics brings to the table. So basically it gives you, it helps practitioner understand whether a particular drug is being effective on a patient, whether the patient is adhering to the treatment, and based on that, he can improvise, or he can improve the, I mean, modify the treatment accordingly to improve or enhance the overall treatment outcomes. So this is the second part of the demo that I have. Now the third part of the demo that I have is basically the patient self-service portal. Just give me a second, I'll open it for you. Just bear with me for a moment. Yeah, reshare my screen. So the last leg of it is patient self-service portal. So Patient Care NXT, our Patient Care NXT Solutions has offers a patient self-service portal that enables patient to execute quite a few activities on his or her own. So he can basically schedule appointments with practitioners. He or she can see his medication reports, lab reports, right? And this portal also enables the patient to track the overall treatment progress, as you can see on the screen. And basically, he or she will be able to see what are the pending care plan activities that he or she needs to complete today. So I'll go to the care plan part of it. Yeah, let me open a care plan. This is the care plan which has already been created. I'll just quickly show you how he will be able to see what are the activities that he needs to complete today, and then accordingly he can. So and this notifications come every day in the morning also, that you need to finish these. So these are the activities that he or she needs to complete today. And so this basically shows the activities which are pending today and yesterday, right? And he can, let's say I need to complete this one. As you can see, this has been already completed. Let's say he needs to complete this one. He has already taken the medicine, so he needs to mark it as complete. Once it is marked as complete, right, this data is the data on which we have, I mean, using which we are producing the real-time clinical analytics that I have already shown to you, definitely along after taking consent from the patient, right? So this is the overall care plan part of it. Now, let me quickly show you the, yeah, and just to tell you, so this entire patient service portal gives a patient ability to execute quite a few self-service capabilities. Along with that, we also have gamification inbuilt into the platform, which basically improves the overall patient adherence to the treatment. If I show it to you, so in his profile, Amber is a patient, and he will be able to see, the points that he has accumulated while completing the treatment activities, and he can also redeem his badge, and also can go beyond, go beyond just looking at it, redeeming the points along with some other advantage. So this gamification aspect is basically for the providers and others to help improve the overall patient treatment adherence. Now, the last part is the symptom checker. So this is a tool that we have built on a authentic healthcare database built by global doctors. So this this is a tool which helps patients self-triage his or her own symptom. So in the backend, first it gets the context from the, so patient record has already been there open, right? So it will first get the details about the patient, right? Age, gender and all. And then it will help, it will take the patient through a guided flow so that patient can provide the input of his or her symptom, and accordingly it will suggest the way forward. So let's say the Amber is facing an eye itching issue. So this particular tool will guide him through the process. So it will basically ask a few questions, and according to that, it will give you an analysis of what's the issue and what's the next step. Yeah. So yeah, so what this is essentially saying is, yeah, it is coming up with the analysis. It might take a moment based on the, yeah. So what it is, this is your issue and this is your possible symptom. And if you want to find what you want to do, you will have to do, that is where it will come up with a suggestion as well, real-time suggestion as well. And then it will, so what it is saying is you have to consult the doctor. So either you can create an appointment on your own, schedule an appointment on your own, or else you can also chat with an agent and help, basically schedule an appointment for you. So these are the three critical features that we have as part of Patient Care Next. As Dr. Ratnakar has already mentioned, we have quite a few left, but I am just giving you a short demo, and that's all I have for you. Over to you, Dr. Ratnakar.
Thank you so much, Subhendu. Wonderful to see the demo. And that actually brings up to the time to sum it up. As you have seen, this particular Patient Care Next came with extensive amount of domain in-depth put in terms of developing this particular healthcare portal. More importantly, this platform is actually being a comprehensive one, helps in terms of navigating through the various needs of the healthcare ecosystem at continuous needs. More importantly, next-gen technologies are embedded in terms of providing some of those cutting-edge areas which today the healthcare systems are looking at. And we have the next two releases coming up shortly, and those would actually provide a greater amount of comprehensiveness in order to, and inclusiveness for having the pharma CROs getting the larger benefit. And we look forward to you, and we look forward to interact with you and maybe collaborate with you in terms of making your healthcare organizations much more seamless, much more integrated, and much more empowered with the Patient Care Next, solving the key issues today as an organization you're grappling with. So I'll turn towards Mandira for a few quick comments. You're on mute.
I'm speaking on mute. My apologies. That was a fantastic demo, Subhendu. I think very well, outstanding example of how partners can make more happen with Microsoft Cloud technologies. And Dr. Ratnakar, thank you for that brilliant walkthrough of what the platform really looks like, and futuristic view of what we can expect. We just wanted to, between Puneet and myself, it's important to sort of talk about, one is a standing example right here, how Persistent has really, explored this brilliant opportunity of extending and innovating and amplifying solutions, leveraging the Microsoft Cloud for Healthcare. So just wanted to sum it up with, sharing a quick view into what are the partner opportunities. If you see the slide, this is just a glimpse of the partner cloud, Microsoft Cloud for Healthcare partner ecosystem. And for us, partners are very critical in helping customers realize the full value of cloud for healthcare, right? If you, Samir, if you can just sort of move to the next slide. Just wanted to sort of sum it up, right? We see partners as foundational to delivering the industry cloud for healthcare to customers. And there are three ways you could really do this. One is really amplifying the value of cloud for healthcare. And Puneet beautifully showed, a layer to layer Lego boxes, a Lego view of the various opportunities that that the cloud for healthcare can present to partners. And, it could be with configurations, it could be with connectors, it could be with, innovative solutions. It could also be extending offerings and current capabilities while, sort of breaking into newer markets. It could also be, a services opportunity. It could be about transforming customers' businesses while helping them realize value. So I think, all in all, while this is an outstanding, fantastic example of how we've come together between Microsoft and Persistent to build this, the next gen, next care patient platform, emphasizing and underscoring the importance of patient care and, with emerging tech. I think, we want to leave you with this thought in terms of how do you really want to sort of really leverage this platform, and how can you really sort of build into this ecosystem with more innovative solutions.
Thank you, Mandira.
Thank you.
We will take two questions. I have on the screen two questions. The question came in from Angie. It would be great if patients had access in their portal to potential research opportunities as part of their care pathways. I will take that question. Yes, this is, as you have seen from our presentation and also from the demo, it did has access to the patients, and it's available for both the patients as well as the providers. So that's one which I would like to take. Then there is another question from Nitin. We have a hospital management system with VHR, but our practitioners are looking for real-time patient assessment. And thank you, Nitin, for this question. And that is one of the core capabilities which were built in as a part of our Patient Care NXT, in terms of providing real-time patient assessment as a part of clinical trial analytics, which we have presented to you. And that is one of the important things which we understand that is going to make a difference for the providers. And Nitin will be more than happy to connect with you and see how we can actually help out in this particular one. I'll take one more question, and I will request Mandira or Puneet, one of you, to answer. Patient adherence is a major challenge. How does Microsoft Health Cloud address the challenge?
Sure.
So you're talking, go ahead, Mandira.
Yeah, no. So I was, and please feel free to chime in, Puneet. So I think, I think all that we do using tech to elevate healthcare goes down the drain if the patient does not take his or her treatment on time, or really, misses their regular critical appointments with the clinician, right? So with the patient insights that Puneet was alluding to earlier, we have a unified patient profile that allows healthcare organizations to sort of seek a comprehensive view of the customer, and helps the clinician get a 360-degree view of every patient to sort of rapidly analyze data unique to that specific case, and ensuring that, they have a view on patients, this whole treatment adherence and patient adherence. And I think Dr. Ratnakar alluded to the whole gamification aspect while we were walking through the platform view. Puneet, do you want to chime in here?
Yeah, and then we have like couple of AI models also, and then partners can also create the AI models. Like at least, we have like a missed appointment, right? So let's say a patient always keeps missing an appointment, and that's the behavior there. So there are certain sets of reminders, and that, okay, to remind them more. And that's where, the partners can build more towards, what the customer is looking for. Like, okay, analyze this is the behavior looks like, and then remind the patients based on, whatever the challenge they are facing. So totally customizable, but we are providing a pre-built few features as well. So
yeah, and
hope
yeah,
that
I think
helped.
and
Yeah,
Puneet,
wonderful,
you were
wonderful.
referring to patients trends, which is an upcoming feature in the cloud for healthcare.
Yeah,
absolutely.
So,
yep.
There is also another very important question, which I will take that. So is it possible to customize it to just one specialty? The example is radiology or nephrology. This came in from Shashank. So thank you so much for this question. And if you saw the presentation, and if you also has the opportunity to look at the Subhendu's demo, the presentation was more towards hypertension. But this particular platform allows customization to any specialty's needs, be it nephrology, be it dermatology, be it oncology. So all the specialties, it can actually be customized, and that can actually be taken up. So we'll be more than again happy to connect with you to see how we can actually help you on that. There is also another very important question which is coming up, which says that does Patient Care Next have connectors to pull HL7 data, which feeds into MC4H? And again, thank you so much for this question. And again, happy to mention to you that Patient Care Next has the required connectors to pull the data, which is of HL7, and it can actually get fed into MC4H. So thank you so much for these questions, and very happy to see great participation from all of you. And once again, Mandira and Puneet, heartfelt thanks from Persistent for the wonderful collaboration we have with you from Microsoft, and together, and the audience have seen now in terms of how Microsoft's partner are joining hands and making life different for the healthcare providers by way of transforming the entire digital healthcare ecosystems by the platforms like Patient Care Next. And again, for all the participants, thank you so much for staying with us all through, for active engagement, wonderful questions. And once again, we assure you that we'll come back again with many more futures in a very short period of time. So thanks once again, and thank you so much.
Thank you for the partnership, Dr. Ratnakar and Subhendu. And thanks,
Thank you so
Puneet.
much.